Ever thought brushing your teeth could affect your heart health? Sounds far-fetched? Well, it may not be. Welcome to a journey where we unravel the surprising connections between oral health and systemic diseases. Imagine your mouth as a bustling city. It's home to countless species of bacteria, most of which are harmless or even beneficial. However, just like in any city, there can be troublemakers. Some bacteria, when allowed to overgrow due to poor oral hygiene, can cause oral infections like tooth decay and gum disease. Now here's where it gets really interesting. Your mouth is not an isolated city. It's more like a major transport hub with highways leading to and from other parts of the body. This means that bacteria or the inflammatory substances they produce can hitch a ride and end up in places like your heart or pancreas. For instance, some research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. And it's not just your heart that's at stake. Did you know that if you have diabetes, you're more likely to have gum disease? That's because diabetes reduces your body's ability to fight off infections, making your gums a prime target. But don't panic. While this may sound scary, it's also empowering. By taking care of your oral health, you're not just ensuring a bright smile, but you might also be taking a significant step towards protecting your overall health. Regular brushing, flossing, and dentist visits can help keep those oral bacteria in check, potentially reducing your risk of systemic diseases. The connection between oral health and systemic diseases is a fascinating field of study. And while we're still learning, one thing is clear. The mouth is not just a mirror of the body's health, it's also a gateway. So, believe it or not, your oral health can be a window to your overall health. What do we mean when we say oral health? Is it just about having pearly white teeth? Not quite. Oral health encompasses much more than just your teeth. It's a holistic term referring to the health of your entire mouth, including your gums, tongue, and the lining of your mouth. Think of your mouth as a bustling city, teeming with activity. Just like in any city, it's important to keep everything running smoothly. That's where oral hygiene comes in. Regular brushing and flossing, along with routine dental checkups, help maintain this delicate balance. But what happens when things go awry? Common oral diseases, such as cavities and gum disease, can wreak havoc in our mouth city. If left untreated, they can lead to severe discomfort, tooth loss, and even contribute to systemic health problems like heart disease and diabetes. Remember, a healthy mouth is more than just a beautiful smile. You may wonder, how can my mouth affect my heart? It's a question that might sound surprising, but the truth is, there's a close connection between oral health and heart disease. Let's think of our mouth as a bustling city. It's home to millions of bacteria, both good and bad. Now, when we maintain good oral hygiene, we keep this city clean and well-ordered. The helpful bacteria thrive, and the harmful ones are kept in check. However, when we neglect our oral health, the harmful bacteria can multiply and take over. This is where things get interesting. These harmful bacteria can cause gum disease, also known as periodontal disease. When gum disease sets in, the gums become inflamed and can bleed. This allows the bacteria a pathway to enter our bloodstream. Once in the bloodstream, these bacteria can travel throughout the body, causing inflammation wherever they go. Now, inflammation is like a fire alarm for our body. It's a signal that something is wrong. And when this inflammation occurs in the blood vessels leading to the heart, it can increase the risk of heart disease. Research suggests that people with gum disease have a higher risk of heart disease. This could be due to inflammation caused by the bacteria, or it could be that those with poor oral health have other risk factors for heart disease, such as smoking or a poor diet. It's important to note that this does not mean that poor oral health will definitely cause heart disease, but it does suggest a link between the two. So, what can you do to protect your heart? Well, it starts with taking care of your mouth. Brushing twice a day, flossing daily, and regular dental checkups are key. Not only will these habits keep your smile bright, but they could also help protect your heart. In conclusion, Our mouths are like the first line of defense in protecting our overall health. So, by taking care of our oral health, we're not just maintaining a healthy smile, we're also helping to safeguard our heart health. So, taking care of your mouth is also taking care of your heart. Now, let's talk about another surprising connection: your mouth and diabetes. You might be wondering how these two could be related, but let's delve a little deeper to uncover the hidden link. When we talk about oral health, it's not just about a bright white smile or fresh breath. It's about the overall health of your mouth, including your gums and teeth. In fact, your mouth is a mirror that often reflects what's going on in the rest of your body. For instance, people with diabetes are more likely to have gum disease than people without diabetes. Why, you ask? Here's the catch. Diabetes reduces the body's resistance to infection, making the gums more susceptible to infection, which can further lead to gum disease. Now, this is where it gets interesting. Not only can diabetes lead to poor oral health, but poor oral health can also influence diabetes. It's like a two-way street. When you have infections in your mouth, like gum disease, your body needs to work harder to fight off these infections, leading to increased blood sugar levels. This can make your diabetes more difficult to control, causing it to progress faster. In other words, a healthy mouth can help you control your diabetes, while a diseased mouth can make your diabetes worse. So, you see, it's not just about brushing and flossing, it's about managing your overall health. It's important to remember that good oral hygiene is more than just a preventive measure for cavities and gum disease. It's a crucial part of managing diseases like diabetes. Regular dental checkups, brushing twice a day, flossing daily, and eating a balanced diet can go a long way in maintaining good oral health and consequently controlling diabetes. Hence, maintaining oral health is crucial, not just for your mouth, but for your overall well-being. So, what should you take away from all this? When it comes to the health of your body, your mouth plays a more significant role than you might think. We've seen how poor oral health can contribute to systemic diseases like heart disease and diabetes. Uncontrolled bacteria and inflammation in your mouth can enter your bloodstream, affecting your heart and blood sugar levels. But the good news is, maintaining good oral health isn't rocket science. It's as simple as brushing your teeth twice a day, flossing daily, and making regular visits to your dentist. By keeping your mouth healthy, you're taking a proactive step to shield yourself from these systemic diseases. And remember, it's not just about avoiding diseases. Good oral health can also enhance your quality of life, from boosting your self-confidence with a bright smile to enjoying your favorite foods without pain or discomfort. Your mouth is a mirror to your body's health, so take good care of it. Subscribe to the channel to see more content from the Health Tree.